Hi, I'm going to be demonstrating some massage techniques for clients with headaches. Okay, first you want to warm up the area, just mobilizing the neck. So we're going to do a little bit of rocking, maybe a little bit of jostling. Okay, just to get the neck to be loose. You really have to get the client to let go of their head for these techniques to be able to work. Okay, so we're going to start by doing friction to the entire scalp. You can do cross fiber friction. Or circular friction. And you want to sink your fingertips in. You don't want to be pulling their hair. You want to sort of sink your fingertips in there and do the friction. And circular friction. There's that dense fascial sheath all over the scalp. So we're trying to start to loosen that tissue. Okay? And you'll do the other side as well. Next, what we're going to do is a little bit of stretching. We're going to do a lateral stretch, so you're going to bring the client's head to the side just until they're sort of slightly resisting. Okay? So, you're going to have your client take a nice deep breath, and on the exhale, you're going to stretch to the side, nice and slow, to that point of resistance. Good. And then another deep breath, and then you're going to hold them there, just back off a little bit, and then on the exhale, stretch. That's good. Okay, we're going to do a slight variation on that with a rotation of the head about 45 degrees. Okay? And then what you're going to do is have your client take a deep breath and a stretch. Good. Okay. Now these techniques you're going to do sort of go side to side. So once you've done one side, then you're going to balance it out and do the other side. So once you've done these stretches, you're going to go ahead and stretch the other side. The next stretch is an anterior stretch. Now this should be done with caution. It should not be done for anybody who's had whiplash, who have had any compression in the cervical vertebrae, anything at all. So only on a healthy person without any injuries should this be performed. What you're going to do is actually stand up and you're going to lift the head, and then you're going to have the client take a deep breath, and you're going to stretch anteriorly on the exhale. Good. And you're going to bring the head back nice and slow. Okay. The next technique is a myofascial pull. So what you're doing is you're taking the finger surface and you're going to be sinking on either side of the vertebrae. Right here I'm about at the level of C7, and my fingertips are sinking into the muscle tissue on either side of the vertebrae. Then what I'm going to do is pull anteriorly. It's sort of like a wave-like motion. Nice and deep, and you're pulling anteriorly with a nice little bit of a stretch at the occiput at the end. Nice and slow. I'll do it on one side so you can really see that motion. So we're basically sinking the fingertips in, you're really pushing up into the muscle tissue, and you're just pulling superiorly. Nice and slow, right up to the occipital ridge. Okay? And then you'll want to balance on the other side as well. There are a couple other myofascial releases that we're going to do. We'll do one for the sternocleidomastoid, and then we'll do another that targets more of the scalenes. Of course, you're going to be getting the fascia of all the muscles in the area. You'll be getting platysma, you'll be getting some of those other lateral neck muscles, but SCM is where we're going to start the focus for this. So what you're going to do is you're going to have your client just gently rotate to the side, just enough so that you can get set up. So you're going to take your hand and you're going to brace it here. Okay? What you're doing is you're compressing into the sternocleidomastoid, but the rule is if there's a pulse, then you don't want to stay on it. So you don't want to compress any of the blood vessels here. So really right on the surface of the sternocleidomastoid here, what you're going to do is press. And as you perform this technique, you're going to have your client slowly rotate their head away from you. Okay? Alright, so Dawn, while I do this technique, I'm going to have you slowly rotate your head away from me, okay? Whenever you're ready. Good. And what you're doing is you're pulling your fingertips through that muscle tissue and that fascia as he rotates. I like to bring it all the way out to the end. That's good. Come back. Now just go to the side, okay? We're going to do that one more time. So we're going to move up a little bit. So what you'll notice on your client is you have some nice hyperemia here, some nice redness. You're really going to get one shot for each of these techniques, because once you've sort of melted and softened that fascia, you're not going to get the same kind of grab. You'll be able to massage it, but it won't be the same intensity of the fascial stretch. You get one shot. So we're going to move up slightly superiorly here. Again, you want to make sure there's no pulse underneath your fingertips. So my hand's right over the sternocleidomastoid. I'm going to use my other hand to brace it. I'm going to compress into the muscle. And okay, when you're ready, turn your head away from me slowly. Ah, that's a good one. This can be very uncomfortable for certain clients, so you really want to be cautious, but this is one of those situations where the release is so good. Okay, good. Nice. Okay, sort of let it loosen up once you're done. We can do one more of those, depending on the size of their neck. You can come right underneath that corner of the mandible. Okay, and you're compressing into SCM, and go ahead and rotate your head away from me slowly. And I like to just sort of follow this one right up to the occipital ridge. Good. So you hit the sternocleidomastoid up here, but you also got some of the other tissues around it. Once you do that, we're going to do something very similar, but it's going to target more of the scalenes. So you're going to start with, again, with the head slightly rotated away from you, even a little bit more rotated away to start this one. And you're going to identify the area of the scalenes. So what you're trying to look for is this triangle between sternocleidomastoid and the trapezius. So we're kind of starting right behind sternocleidomastoid on this technique here. Okay? So, Dawn, while I perform this technique, I'm going to have you slowly turning your head side to side, like slowly shaking your head no as I do this technique, okay? So, whenever you're ready, go ahead and go side to side. Good. You want to go, yep, there you go. Yep. Good. Good. Yep. And now you're slowly pulling across the surface of the muscle to really grab that fascia, all those little scalenes. Good. You have a pretty small window in here where you really have access to the scalenes, and then you can perform it. Come up slightly superiorly. You're tucked behind the sternocleidomastoid. Okay, Dawn, and starting right about here, I want you to do just about like this sort of side to side right here. When you're ready, okay, go ahead. Good. Good. Yep. Okay. So you're going transversely. You're going across the scalene fibers. Good. Okay. So, once we've gotten to that point, you're going to want to do those myofascial techniques on the other side. So, you'll come over here.